Imagine your body as a highly secure fortress, constantly monitoring for anything that does not belong. When a foreign object enters, even something intended to help, your body's defense system springs into action. It is a natural and vital process, but what does this mean for advanced medical implants? Yes, implantable device materials can absolutely cause tissue rejection. However, the science and engineering behind modern medical implants are incredibly sophisticated, making significant rejection a much rarer occurrence than it might seem. The goal is to design devices that coexist peacefully with your body, promoting healing and function rather than triggering an immune response. The core mechanism behind tissue rejection lies with your immune system. When a foreign material, like an implant, is introduced, immune cells identify it as non-self. This can trigger a cascade of events, from acute inflammation immediately after implantation to a chronic response where the body tries to wall off the device with a fibrous capsule. Factors like the material's chemical composition, its surface roughness, and even its shape can influence how aggressively the immune system reacts. For example, a rough surface might inadvertently provide more sites for protein adsorption, which can then be perceived as a threat. To counter this, engineers and materials scientists rigorously select and design biomaterials with biocompatibility as the paramount concern. This means choosing materials that are inert, meaning they do not chemically react with biological tissues, and non-toxic, ensuring they do not release harmful substances. Techniques such as surface modifications, including specialized coatings or textures, are also employed. These can encourage specific cell types to grow onto the implant, promoting integration, or they can create a stealthy surface that avoids immune recognition altogether. Every potential material undergoes extensive in vitro laboratory testing and in vivo animal studies to predict and mitigate possible rejection responses. One fascinating aspect is the development of advanced polymers and ceramics like PEEK, which is polyether ether ketone, commonly used in spinal implants, and highly purified titanium alloys. These materials are chosen not just for their mechanical strength, but also for their excellent resistance to corrosion and their ability to integrate with surrounding tissues. Sometimes, devices even incorporate specific growth factors or drugs to actively guide tissue healing and minimize inflammation directly at the implant site, ensuring a smoother transition for the body. Ultimately, the incredible progress in biomaterials science means that while the body retains its natural vigilance, the risk of serious tissue rejection from implantable devices is significantly minimized. Through careful material selection, innovative surface engineering, and thorough testing, these devices are designed to seamlessly integrate, allowing them to perform their life-enhancing functions without triggering a major conflict with your biological systems.